thank you so much for being here. I'm gonna give you a little bit topics about the joint action JARDIN. And I do not have any potential conflict of interest to report right now. And this is the content that we will be talking about the joint action. So first of all, the background of JARDIN joint action. As you have already know, the Directive 2011-24 in the European Union on patients' rights and cross-border healthcare give us the basis of the European reference network model and the legal framework for the creation in March 2017 of the creation of the 24 European reference networks across 900 units. As you have already know, the 24 ERNs are dedicated to rare diseases and complex conditions. Our ERN TransplantChild is the only one that is dedicated a complex procedure like a pediatric transplantation. The other 23 European reference networks are dedicated, for example, to organ diseases, for example, liver or kidney or respiratory rare diseases. After 2022, with the expansion of the European reference networks and the new inclusions of full members and affiliated partners, we are 1,600 units across 400 hospitals. Among the 27 European Union member states, plus Norway. Between the governance body of the ERN systems is the board of the member state, that is composed by all the representation of all countries, health ministries of each country and Norway, and they created different groups across the European reference networks. One of them was the integration working group, and in 2011, this integration working group state that all member states are encouraged to facilitate the integration of the ERNs to their healthcare system by 5 items. The first one is assessing, adapting, or updating the national policy and or the legal framework to ensure the integration of the ERNs. The second one is by creating appropriate patients' pathways in order to improve the care and management of people living with complex conditions or rare diseases. The third one is developing clear system for referral to ERNs to be used by the healthcare providers. The fourth one is developing a clear strategy for communicating and disseminating information about the ERNs towards all levels of healthcare providers in our own territory. And finally, by reflecting on the means to best support, administrative, financial, organizational, informational, etc., the best support to coordinators, ERN members, and affiliated partners to ensure patients will have access to the best available expertise. So that after this clear statement of the integration working group, and supported by the board of the member states, in 2022, the EU for Health Work Program was launched a direct grant to member states authorities in order to support the ERNs integration to the national healthcare system of member states. All the member states plus Norway should participate in this joint action. And the expected results and impacts were settled in 5 points. First of all, the exchange of the best practice. Secondly, the concrete proposals or recommendations for better integration of the ERNs into the national healthcare systems, especially for patient pathways or referral procedures. The development of national networks on rare diseases, and to produce guidelines for development of national teleconsultation tools interoperable with the CPMS. And this joint action should develop a mechanism for monitoring the progress and implementation of this proposal guidelines model and recommendation. So this is the expected result of all this joint action. We started with the preparation of the proposal in September 2022, almost 2 years ago. Our proposal was submitted in March 2023, and after the evaluation, the grant agreement preparation, the grant was signed in December 2023. The joint action started 1st January 2024. So, but what is JARDIN or JARDIN in Spanish? JARDIN is the joint action of on integration of the ERNs, all the European reference networks, into national healthcare systems. This joint action has the participation of all European member states, plus Norway, plus Ukraine, and this grant is, this joint action is co-funded by the European Union. This joint action this joint action has 3 years, for being more precisely, 37 months, 3 years plus 1, and we are now in the month 11. In short, this joint action on integration of the ERNs into the national healthcare systems brings us the opportunity to improve the accessibility to the ERNs by integrating them into the national healthcare systems. This is our slogan, Together Now, and this is our logo. The consortium is composed by 27 member states, plus Norway, plus Ukraine. We are almost 58 participants. Our coordination team is located in the Medical University of Vienna in Austria, specifically coordinated by Professor Till Voigtlander. As you can already imagine, it's a really huge consortium with a very difficult task, that is to integrate the ERNs into the national healthcare systems. Our objective is to enhance the impact that have already has the ERNs by addressing all the aspects of the better integration into national healthcare system, improving national governance models, quality assurance models, patient pathways, referral systems to the ERNs, by supporting the information of the national reference networks and undiagnosed disease programs, and improving the data management and identifying the national support options for the ERNs healthcare providers. To do this, we have to develop strategies for systematic dissemination of the information on the ERNs, especially across two main actors or stakeholders that are patients and patient associations, as well as clinicians or medical community. And to ensure obviously the sustainability of the proposed actions and implementations that will be produced by the end of the joint action. But how this consortium or this joint action works? So our main governance body is the management board. When all the 58 partners participate, and we are the steering committee that is composed by the all work package and leads and co-leads are dealing with the day-by-day of the joint action. The joint action is divided in two main work package groups, the transversal work groups and the content or technical work package. And this consortium can make recommendations and proposals and guidelines without an advisory board. Our multi-stakeholders advisory board, we have specific groups: national contact policy, the hospital manager, the data management, and the patients, that is mainly composed by umbrella patients representatives. And other stakeholders, like, for example, other ERN coordinators that are not actually involved in any of these work packages. The transversal work packages has the participation of all competent authorities. These 4 work packages are similar to the ERNs, except by the work package 4, that is the sustainability. But this work package is necessary for all joint actions. These joint actions, where all European countries are involved, need to have a proposal and recommendations in order to make real their own recommendations. So that is the reason why all the joint actions have the sustainability work package. The coordination, as you have already know, is led by the Medical University of Vienna. We, as a team of La Paz University Hospital, lead the dissemination work packages. The work package 3, dedicated to the evaluation, is led by the University Hospital Center of Zagreb. And the sustainability work package is led by Vilnius University Hospital in Lithuania. The content work packages are: the number 5 is the National Governance and Quality Assurance Model, that is led by the Rizzoli Orthopedic Institute in Bologna, Italy, and co-led by the Medical University of Vienna and the University of Pisa. They are leading with all the national governance models. As you have already know, we have big countries, small countries, centralized healthcare models, regional healthcare model. So we have to produce all recommendations for all the different countries that we have in the European Union. The work package 6 is dedicated to the national care pathways and ERN referral systems. This work package is led by the Vilnius University Hospital in Lithuania, the Health Service Executive in Ireland, and the Medical University of Vienna. The work package 7 is devoted to the national reference networks and undiagnosed disease programs. This work package is led by the University Hospital of Tübingen in Germany and the Medical University of Vienna. The data management is the work package 8. This work package is led by the Ministry of Health and Prevention of France and the Medical University of Leiden in Netherlands. And the final work package is the national support options for the ERN healthcare providers, led by the General University Hospital in Prague, in Czech Republic. So by month 11 of the joint action, we have created all the communications channels. Please visit us, the website, and follow us in the social media. You can scan the QR code in order to enter and visit our website. It's important that you can know it and explore all the contents that we have already produced. And also, if you are not directly involved in the joint action, please subscribe to our newsletter. This is a biannual newsletter. The first one was launched in October 2024 with all the JARDIN news, member states news, and the upcoming events important for all the ERNs and the integration of the ERNs into the national healthcare systems. And also, I would like to invite you to visit the program of the next European Economic and Social Committee workshop. This event will be the next Friday in Budapest, and also you can register in order to follow this event online. The idea is that every 6 months, the country presidency of the European Union make or do this kind of events in order to tackle all the rare diseases and increase the awareness on rare diseases and complex conditions across the European Union. And as you have already know, since this year, the DG Sante has been involved in these national workshops about the information of at national level on patients' rights in cross-border healthcare and European reference network. The next one will be on Romania and Hungary and in France. So this is everything from my side. You have our contact, especially if you have interested in anything about the joint action. Please write us by email or send us an email through the website or through the communication at jardin-ern.eu.